Good morning, everybody. Thank you very much for coming to hear this talk about working in the NHS. My name is Linda Dean. I'm a senior lecturer at the University of Bedfordshire. Just to tell you a little bit about myself, I started many years ago as a nurse in the NHS. Back in the 80s, things were very different then. I did my 3 years nursing as an adult nurse. I worked at the Luton Dunstable Hospital for a while, so fairly local. Then I moved on to work at the spinal unit at Stoke Mandeville, worked there for quite a few years, and I've worked at the University of Bedfordshire since 2004, so quite a while. So great place to work, some great nursing courses and other healthcare courses. So what I'm going to do today is just tell you a little bit more about the courses that we run. So thank you for some of the comments. I can see some of the comments coming up already, so it's good to see your comments. A couple of names that I know. I will be taking questions at the end, so forgive me if you ask a question. If I ignore you, we will address the questions at the end. So the aim of today really is to very much just give you a bit of an insight into what it's like to work in the NHS. I will be talking about some courses in detail, particularly some of the degree courses. Some of the courses I'm not an expert on at all, so I admit I won't know about every single job in the NHS, but I will do my best. So really the aims of today's session are to think about the realities of working in the NHS, to talk about some of the available careers, think about how to take this forward if you have an interest, and then also to talk about the rewards for a career in healthcare. There's so much in the press at the moment about working in healthcare that might concern you, but actually to talk about some of the rewards, because the rewards are absolutely incredible. So I appreciate today I will have a range of people here. You might be one of those lucky people who knew from when you were about 4 or 5 years old that you wanted to work in healthcare. But equally, you might be somebody who's thinking, I might want to work in healthcare, but I'm really not sure. And I know I want to work in healthcare, but there are just so many choices. I really don't know where to start. And that's absolutely fine. I was one of those very lucky people who from the age of 5, I remember being bought, it's very stereotypical, but I was bought my little nurse's outfit. And from then on, I knew I wanted to be a nurse. And if my parents were going to visit people in hospital, I always wanted to go to the hospital because I just knew I loved that environment. And I just knew that I wanted to be a nurse. But not everybody is the same. And admittedly, there are so many different choices for you out there that it's quite a big decision to make. So working in the NHS, there are something like 350 different careers available to you within the NHS. And certainly 40 years ago, if somebody had said to me, what are the jobs in the NHS? I would have been sort of listing maybe 5 jobs. You know, typically you think, well, you can be a doctor, well, you can be a nurse, well, you can be someone who takes x-rays. You might know about a physiotherapist. But a lot of the jobs we know about in the NHS are very much based on personal experience. So obviously, you know, a GP exists because we will often go and see a GP. You might have had friends who've had mental health issues. You know that there are mental health nurses. You might have had to see a physiotherapist because you've broken your leg. So you might know about a physiotherapist. But there are loads and loads of background jobs within the NHS. You know, we have psychologists, we have housekeepers, we have gardeners, we have electricians, as I mentioned before, dietitians, occupational therapists. And even if you narrow it down to wanting to be a nurse, there are so many jobs within nursing that you can branch out into specialist fields. So no job is a standalone job. So there are all sorts of jobs available. So I'm going to start by talking about nursing, because if I asked you about jobs in the NHS, probably near the top of the list would be nursing. And years ago, when you applied to do nursing, you did something called general nursing. And that is still the case in some countries. But in this country, nursing is divided into 4 different specialities. And they are all quite different in themselves, but also they have common factors. And one of the common factors is that you will be caring for people. So I'm going to start by talking a bit about adult nursing. And I would say that if you know that you want to be a nurse, but you're really not sure what type of nurse you want to be, adult nursing might be a good option for you. Most universities will have more places for adult nursing than other fields of nursing. And once you have finished your course as an adult nurse, there are many, many different areas in which you can specialise. So you might want to work in accident and emergency department. You might want to be a community nurse and go and nurse people in their homes. You might want to go into be a specialist nurse. You can specialise in areas such as cystic fibrosis, or you could be a diabetic specialist nurse, or you could specialise in caring for elderly people. You could work in intensive care. You can travel. You can work on cruise ships if that's what you want to do. You know, so as an adult nurse, there are hundreds of different options for you to specialise in once you've qualified. Important to say, I think, that, you know, we all watch programmes on TV about nursing. You see nurses working in accident and emergency, and it can come across as a very exciting and stressful job. Sometimes it will be very stressful. But nursing isn't all about working in these environments. And equally, you might be the sort of person who wants to work with elderly people. You know, perhaps you want to work in an environment where you really get to know your patients, whereas in accident and emergency, there is a very high turnover of patients. So there's lots and lots of options out there for you. So the second field I'm going to mention is children and young people's nursing. So as a children's nurse, you can be caring for people from a very young age, so neonatal, obviously when babies are born. If there are problems following the delivery, babies might be admitted to the neonatal unit or special care baby unit, as you know it. So as a children's nurse, you can be caring for babies from birth, but right the way through to young people of the age 17, 18, occasionally overlapping in sort of 19 years old. So it's really important with children's nursing not to assume that it's all about caring for babies. You know, as I say, there's lots and lots of different age groups that you will be caring for. And almost more importantly, it's important to remember that you will be caring for or supporting the parents and carers as well as the children. So, you know, it's important. Occasionally people say to me, well, I've chosen to do children's nursing because I don't really get on that well with grown-ups. I relate better to children. But it's really important that you can build a rapport with the parents. Most people, when their children are in hospital or their children are sick, they're going to be really, really anxious. So being able to talk to adults is really important. Learning disability nursing. So third field that I'm going to mention is, as the name suggests, about supporting people who have learning disabilities. And again, you could be caring for people from a very young age right the way through to elderly people who have learning disabilities. Much of learning disability nursing will be taking place in the community, but also you can work in residential settings as well. And lastly, mental health nursing. And certainly over the last, 10, 20 years, mental health nursing has become increasingly popular. Back in the 80s, when I was a student nurse, I did a placement in a mental health setting. And really it was just about keeping people in hospital, making sure they were safe, and making sure that people in the community were supported. So as a mental health nurse now, it's developed hugely over the years, and there are many applications to do mental health nursing. So once you qualify as a mental health nurse, again, a bit like any of the other fields of nursing, you can specialize in different areas. You could work with dementia patients, you could work in a hospital setting, so on an acute admissions mental health ward. You could work with children with mental health issues. So again, there's lots and lots of different specialities within mental health nursing. And the thing, I think it is really important to appreciate that you can never separate every field of nursing completely. So adult nursing, if you choose to do adult nursing, some of your patients will have mental health problems. If you choose to do child nursing, some of your patients will have mental health problems. If you choose to do learning disability nursing, your patients will have physical problems as well as the learning disability. So you really can't separate every field of nursing completely. And I think for that reason, sometimes you might be thinking, well, I don't know. I don't know whether to do adult nursing or mental health nursing. Don't worry, because you will still see elements of your other interests as well. So midwifery is always a very popular profession. When I go and talk to young people in schools, there's always a lot of interest in midwifery. But I know if I spoke to my midwifery colleagues, they would say, please make sure that people understand that it is about caring for pregnant women. It's not all about delivering babies. So typically, a woman finds out that she's pregnant, she goes to her GP, and then she will be seeing a midwife, throughout the pregnancy. So lots of being a midwife is about health promotion advice, supporting people who might have social problems within their pregnancy. So the actual delivering the baby is actually quite a small part, or obviously a very important part of being a midwife, but it's quite a small part of being a midwife. But I know from talking to friends who are midwives that it is an absolutely incredible job. So definitely, if you are interested in midwifery, it's one to find out more about at university open days and so on. Paramedic Science. So lots of different jobs working in the ambulance service. You can do a degree, so you can do a Bachelor of Science degree in Paramedic Science and become a fully qualified paramedic. But equally, if you're not particularly academic, you can be a technician. and still work within the ambulance service and support the qualified paramedics. I think probably, and people might disagree with me, but I think paramedic science is probably within the NHS the job that you do need to be very, very tough for. And you need to know an awful lot about a lot of different conditions. So as a nurse, I've only ever done one shift with a paramedic crew, and I tagged along. It was a Friday evening. I tagged along with them from 3 o'clock in the afternoon until midnight. So I never appreciated until then how many different types of patients that the paramedics will see. So within that 9-hour time span, we went to a road traffic collision. We went to a lady who needed to be admitted to a mental health hospital. We were called to a young girl in the street who was unconscious because she'd got so drunk. We had to take a diabetic child to hospital because their blood sugar was really low. We went to a gentleman who had fallen out of his chair and was unable to get back into his chair. So it was purely, that was all we had to do, and then just wait for someone to arrive to sit with him. So as a paramedic, you really will see a huge range of patients. Some of you might have an interest in paramedic science. You might watch some of the programs that are on TV at the moment about being a paramedic, and you will appreciate that there are also a large amount of people who call for paramedics purely because they're lonely. Perhaps they've got mental health issues. So yes, it is a job where there's lots and lots of high drama, but still a job where you need to be very compassionate with people. You need to be patient. You need to be prepared to spend time with people. Physiotherapy. So I think physiotherapy is a very popular course to study at university. But again, it's a very academic course if you choose to study to do the BSc in physiotherapy, which would be a 3-year degree course. But again, all of these jobs that I'm talking about, yes, you can do the degree level and qualify as a physiotherapist, but equally you could work as a physiotherapy assistant. So not only is this absolutely fine if you don't want to go the academic route, but also it's a good thing to do if you want to find out a bit more as to whether physiotherapy is the right job for you. So, you might think, well, I think I would be interested, but I'm not really sure. So if that's the case, then it's really good to work as a physiotherapy assistant. And lots of jobs within physiotherapy, but they can take it from different angles. So you could be working with people who have disabilities, helping them to reach their full potential. Maybe you're working with elderly people, helping improve their mobility. You could specialize in sports physiotherapy and work with people who've had sports injuries, or maybe people who've had strokes. And unfortunately, people can have strokes at any age. So you could be helping people regain their independence as much as possible following a stroke. And again, with physiotherapy, you can choose to work in a hospital setting, or equally, you could work in the community, going to people in their homes, giving them physiotherapy in their own homes. And alongside physiotherapy, because they do work very closely together, is the role of the occupational therapist. And again, like physiotherapy, if you are academic, you can do a Bachelor of Science degree in occupational therapy. And as it says on the slide, occupational therapists provide practical support to help children and adults of all ages with mental, physical, social or learning disabilities. So I work on the spinal unit. I sometimes do shifts there at Stoke Mandeville. So I see a lot about what occupational therapists do. And they could be teaching people to cook again, you know, from a spinal cord injury point of view. I've walked onto the children's spinal injury ward, and I've seen occupational therapists playing games with the children like Connect 4. And at first glance, you think, oh, that's really nice. They're just playing games with the children. And then you realize that actually being able to pick up the Connect 4 pieces is really good for helping children regain the use of their fingers and get that fine finger movement back. So lots of what occupational therapists do will be, you know, just spending time with people, helping them to practice things like picking up playing cards or playing games and playing Monopoly and moving the piece around the board, or teaching them to cut up an apple again, or teaching them how to dress themselves. And then on the other end of the scale, as an occupational therapist, you might be going out to people's homes to see if it's suitable. Let's say it's somebody who's had a spinal cord injury and they will be returning home in a wheelchair. The occupational therapist would be involved in looking at things like, are the doors wide enough? How is that patient going to get upstairs? Can they get to the toilet downstairs? So a hugely wide range of activities are involved within being an occupational therapist. Operating department practitioners. Operating department practitioners, they didn't really exist when I did my training as a nurse. You know, we had theatre nurses who worked in theatres and they would support the anaesthetist. So as an operating department practitioner, this would be a degree course. So you need to do a BSc to qualify as a operating department practitioner, or ODP as we say in short. And their job is to support the anaesthetist when a patient is having an operation. And that is a very brief summary of what an operating department practitioner does. But if anyone listening to this has had an operation, they will appreciate that before you have your operation, you will go into the anaesthetic room and there will be someone in there who is hopefully reassuring you, because it's accepted that you will be very anxious. They will be checking your blood pressure, your heart rate, your oxygen levels. They will be helping the anaesthetist to prepare medication for you. And that would be the operating department practitioner who is doing all of those tasks. During the operation, whilst the patient is asleep, they will be supporting the anaesthetist, checking the patient's observations, checking blood loss, making sure that everything is going okay. And then after the operation, they will be helping the patient to come round from their anaesthetic. Again, lots of different specialities within operating department practitioners. You could choose to work in obstetrics, so be helping care for women who are having cesarean sections. But often within the hospital setting, you will be called to emergency situations such as cardiac arrests, and you will be involved in those situations. So quite a dramatic job, I suppose, if that's the sort of thing that you are looking for. So there are so many other careers within the NHS, and I'm not going to pretend to know about every single career. So I'm just going to move on to talk a bit more about some of the attributes that you need to work in the NHS. And I suppose the main thing is that you need to want to work with people. You know, within the NHS, I'm sure many of you listening to this presentation will have had involvement with the NHS. As I said, most people have been to their GP. You might have visited relatives in hospitals. And I think one thing you would always expect is to see a healthcare professional who's friendly towards you. So, you know, do they introduce themselves? Are they approachable? Do they come across as being professional? Are they able to answer your questions? Are they helpful? Are they polite? And I think as a nurse, not everybody is feeling at their best when they go to work every day. You know, we sometimes go into work, don't we? And you might think, oh gosh, I'm really tired. I didn't have a good night's sleep. And the thing that you do have to is put that to one side and just give your friendly, your helpful image, your smiling, and you are welcoming. And unfortunately, we do hear about a lot of bad press within the NHS where this hasn't happened. And again, it's about being non-judgmental, isn't it? It's about giving people time. It's respecting everybody's beliefs, and really listening to what people want, because you might have a very fixed idea in your head about the care that people have. And you know, I think a good example is in end-of-life care, you know, and people might specify that there's a certain way they want to be treated, and you might not agree with that, but it's about respecting your patient's wishes. Whatever you do within the NHS, it will always be about respecting people's wishes. And whether you choose to work in the NHS as a housekeeper, whether you are a nurse, whether you are a matron, you will not avoid your patient. So it is all about being able to talk to people. Teamwork. Teamwork is hugely important. You know, I can't really think of any jobs in the NHS where you wouldn't be working within a team. So even if you choose to be a district nurse and you're working on your own in the community, you're going out to see patients in their homes, you will still be working in a team that's connected to your GP surgeries. You would be working very closely with GPs, you would be working very closely with healthcare assistants, you might have social workers you're working with. And obviously, if you're caring for people in the community, then you are having to work with patients' families and help them to make decisions. So always working in a team. And sometimes I go into placement and I see student nurses in placement, and often they will say to me, wow, you know, I just hadn't appreciated how many people are involved in caring for one child within hospital. So you may be working with social workers, you may be working with doctors, nurses, physiotherapists, occupational therapists, pharmacists, about what medication that child or adult might need. You may have psychologists involved, you may have specialist nurses involved. So you're always working within a team. Organisational skills, you know, as a nurse, as any kind of healthcare professional, whatever you do within the NHS, you need to be able to organise yourself. And whether that's talking about organising yourself at home, because most jobs within the NHS, or an awful lot of jobs within the NHS, you would be required to do shift work. So you really have to think about, can I work in the NHS? Am I able to do night shifts? Do I want a job where I might be working weekends or I might be working bank holidays? But also So that's sort of organisational skills on a broad level, but also you need good organisational skills on a day-to-day level of caring for your patients. So, you know, typically you come on to shift in the morning and you need to look at how you are going to plan your day. So you do need to be an organised person who's very good at prioritising. Communicating. So I think this figure is right. It certainly was right when I looked a year ago. Something like 90% of complaints within the NHS are because of lack of communication. A few years ago, there was a doctor who sadly died. She was a consultant, but she had cancer, and she obviously spent an awful lot of time in hospital, and she would have a lot of people come into her to take bloods or to take her to x-ray. And the thing that struck her was how few people actually told her who they were. And she started a campaign which was called Hello, My Name Is. And you will see on some hospital badges now, they have staff wear a badge saying, hello, my name is, and then it has their name on the badge. And it made a huge impact because so many hospitals took on this initiative, making sure that all of their staff introduce themselves to their patients. So I think all of us would agree that if you are having care in a hospital setting, it's really nice to know who your patient, who your nurse is. You know, who is the nurse that's looking after you? Who is the doctor? You know, if it's a physiotherapist, do they tell you their name? So communicating and telling your patients or your service users what is going to happen is so important. And I think all of us, if we communicated better within the hospital setting, there would be a lot less complaints within the hospital and within the NHS. So I keep talking about when I was a nurse back in the 80s, but in those days it was very different being a nurse or any healthcare professional to what it is now. But as a nurse, you know, it was very much about doing what you were told to do by the doctors. And now nurses work much more independently. All qualified nurses now have to have a degree, and they are encouraged within that degree to be critical thinkers. And it used to be very much you would hear, why you would ask a question, and I remember asking many questions as a student nurse, and I would say, why do they do it like that? Why do they turn patients every 3 hours? Why do we do patients' blood pressures every 4 hours? And it was always kind of, well, that's how it's always been done, so that's how we've done it. Whereas now we are much better at thinking about individualized patient care. So just because it's right for one patient to be turned every 3 hours, it doesn't mean that it will be right for the patient who has the same condition, but there are other variables in there. Maybe they're a different age, maybe they're a different size, maybe they have different understanding, and so on. So nowadays we talk a lot more about individualized patient care. So whatever sort of nurse you are, you know, as an adult nurse or a children's nurse, I might care for 30 children over the space of a year who've all had their appendix out. But every child will be different. Every child will have different needs. Every child will have a different social background. Perhaps their parents will have a different understanding. Sometimes I might be caring for a child who have very well-informed parents. And other times you might be caring for a child where the parents need more support in their understanding. So definitely any job within the NHS now, you are taught to be very independent in your thinking. There are many jobs within the NHS that are highly skilled, and there are many nurses now that are taking on roles that were traditionally performed by doctors, so very highly skilled. And a lot of jobs within the NHS are very academic, but equally there are a lot of jobs there that aren't so academic, and are very hands-on jobs. And these jobs are equally important. So I've already mentioned that a lot of the courses or the jobs I've talked about, if you want to follow these careers, certainly in nursing, physio, occupational therapist, paramedic science, traditionally you would follow a degree route, and those would generally be 3-year courses. You would be a full-time student at university. Most of the courses are half practice and half theory, so as well as learning within the classroom, you would also be learning within the practice setting. There may be an opportunity to do some of these courses via the apprenticeship route, but I think you need to appreciate, let's just talk about nursing briefly. Let's say that you want to be a nurse, but you don't want to follow the traditional degree route, and you think maybe I will do an apprenticeship route. You would need to be employed by your local trust. So really, if a trust or if a hospital want to put you through an apprenticeship route, they're going to want to be convinced that you are really committed to the course. So normally you would go and work for a hospital trust for maybe 6 months, maybe a year, and then you could approach that trust and say, I would like to progress my career. And if they are convinced that you are focused, you are committed, then they may well help to support you through an apprenticeship route. And you would have the same qualification at the end of the course. You would still have a degree, but would just be a very different route into that degree. Do remember that if you choose to try and follow that apprenticeship route, often you will be expected to stay and work within that setting once you're qualified. So whereas the degree route, you are a completely free agent, you can move around, go and work somewhere else once you're qualified. I'm going to mention very briefly the NHS Constitution, because if you are going for any interview, whether you are applying for a university course, whether you are going for a job as a healthcare assistant or any job within the NHS, this is something that it's really worth reading up on. Some universities will use it within their interview process. So just think about it and think about, you can go online. If you go online, put in NHS Constitution, you will get the full Constitution up. But this is what it talks about. And I think you would all agree that regardless of your job within the NHS, it should be all about working together for the patients and making sure that your patients will always come first, treating your patients with compassion, treating not only your patients with respect and dignity, but also families and also the other staff that you are working with, recognizing that you are there to improve patients' lives. So in terms of, unfortunately, not everyone that you care for is going to get 100% better and return home. So often we are talking about improving lives to what is realistic for that person. Commitment, so being committed to working in the NHS and being committed to giving a high quality of care. And everybody counts, so all of your patients will be treated equally regardless of their background that they come from. Having a professional image is really important. you know, again, I'm sure if you've been into a hospital, you might have seen people who you think might look a bit unprofessional, whether that might be because of the language they're using. Maybe you see nurses smoking outside in uniform. You know, maybe it's a nurse with a grubby uniform. So we talk a lot in the NHS about maintaining that professional image. So that is really important. How am I doing for time? Not too bad. Okay, what does a healthcare professional do? And the reason I put this slide in is because there was, when nursing first went over to degree, and when a lot of the jobs I've talked about are degree courses, there was this myth going around that a lot of nurses would think they were too posh to wash people. And that became a phrase, you know, I've got a degree, I'm not here to wash people. When I was 18 years old and I started nursing, I was told by my lecturer, or as a class, we were told by our lecturer that when you got sick of washing people, that was the time to give up nursing. Because if you have a poorly patient, and this is very nurse focused really, but you could relate it to any of the other professions. When you have a poorly patient and they need personal care given to them, so all of you, some of you might still be in bed, I don't know, but if you have got up this morning, all of you will have got up and you will have taken yourself to the toilet. You might have had a shower, you might have had time to have a bath, you might have just washed your face and hands quickly, you will have cleaned your teeth, you might have put makeup on, you will have brushed your hair, and you might, if you were really organised, have had breakfast. And all of these things are things that we do day in, day out, without even thinking about it. And as a healthcare professional, a lot of what you will do will be supporting people with very basic needs. So it is important to remember that it isn't all about high drama. You know, a lot of it will be very basic care that you are doing for your patients. And as I said at the beginning, there are areas such as intensive care, accident and emergency, being a paramedic, that are quite high stress, high drama environments, but also there will be situations where you are giving very basic care to your patients. So what are healthcare careers not about? Well, I would say it's not all about glamour. You know, it certainly isn't an easy life. It's not about earning lots of money, and it certainly isn't about just sitting behind a desk letting healthcare assistants do all the hard work. You know, we're coming back again to talking about teamwork, but really making sure that the rest of your team are supported. And often I will go into a healthcare setting, perhaps I'll go onto a ward at the local hospital to see student nurses, and I sometimes see the ward managers getting on, they've got an apron on, they've got a pair of gloves on, and they are doing basic patient care because they are supporting their team. So definitely about teamwork. So we hear a lot in the press, don't we, about nurses, about other people working in the NHS, doctors, how hard it is, how everybody is overworked. And you might be thinking, oh my goodness, why would I want to do that job? Well, I can 100% say to you that I have never, ever regretted being a nurse. There is excellent career progression. So whatever you choose to do within the NHS, you can progress your career. You will have fantastic job satisfaction, and that doesn't matter whether you are a nurse, a doctor, a physio, a pharmacist. Every day at the end of your shift, you will know that you have helped somebody, probably more than one person. And, you know, I can't list the times that people have said to me, thank you, you know, and it could be something really, really simple that they thanked me for. But most of your patients will really appreciate what you do for them. It's a varied career, you know, and you can change any time within your career. So, as I said, I started as an adult nurse and then I became a children's nurse. If I wanted to, I could go and be a mental health nurse if I was prepared to do another course. It's a flexible career, you know, and I did mention shift work, but shift work isn't for everybody. So there are jobs within the NHS where you don't need to do night shifts. You don't need to do shift work. You will always have a job. You know, our students at the end of their degree courses, if they want a job at the end of the course, they will get a job. The good thing about working in healthcare is that you can work anywhere within the country. You can work in an awful lot of different countries if you want to emigrate elsewhere. So I'm not encouraging everybody to go and emigrate, but there are many, many different options there for you. Just to talk briefly, and you've probably done your research, but qualifications, if you were looking to do medicine, then you would definitely be needing to get very, very good grades at A-level, and definitely you would need to gain work experience. And if you are thinking about medicine, if you go to your local hospital and say to them, you know, I'm really interested in medicine, can you arrange some work shadowing or some voluntary work for me? They can often do that for you. Most of the other degree level courses, you're looking at 112 to 120 UCAS tariff points. That might vary at different universities, so you need to do your research. And you need to have maths, English and science at GCSE. And certainly courses like physiotherapy, you would need to have a science at A-level. And any job in the NHS, you know, or certainly if you are looking to apply for university, if you can get care experience, then that will be an advantage for you. And that doesn't have to be formal care experience. You know, maybe that you've cared for an elderly relative. Maybe you have a child with complex needs or a sibling with complex needs who you help support. Maybe you know somebody with mental health issues who you've supported. Just to mention briefly funding, if you are choosing to go the academic route and study a degree, most students will have a student loan, but you don't need to start paying that back until you're earning about £27,000. And if you are choosing to do a course such as nursing or any of the other allied health degree courses, you get a government payment of a minimum of £5,000 a year, and you don't need to pay that back. So definitely that's worth a lot to you. It helps with your travel costs and your accommodation. So where am I time-wise? Okay, I think we've got about 10 minutes left. So if anyone has any questions for me, then please feel free to put them in the chat box. I'm just going to go through. Okay, so I can see someone's put, I already have the medical assistant certificate, but I graduated in Romania. How can I equate this certificate to be able to work in the UK? I'm not sure if you're talking about working in the UK or if you're talking about studying in the UK. If you were wanting to study a degree in the UK, then if you send the evidence of your medical certificate to the admissions department of a university, then they would be able to tell you if that could go towards admission criteria for the course you want to do. If you are talking about working in the NHS, then you would need to contact the Human Resources Department of your local hospital, and they would be able to advise you. Okay, any other questions that people have at all? Yeah, as it's just come up on the chat, you might have questions that you might get home, or you might suddenly think of them over the weekend. Please, please, please do email me, linda.dean@beds.ac.uk. As we always say to people, there is no such thing as a silly question. So you might think it's a silly question, but I'm very happy to answer any questions that I can.